more Vaccine Central, and we do have live team coverage on those efforts, including how our state's rollout plan compares to the national plans. Channel 2's Robert Arnold has a closer look and joins us live from a county testing site in Northwest Houston. Robert?
Yes, COVID testing sites like this one at the Bear Creek Islamic Center help boost the numbers because it makes for easier access to those who live in the area. Now there is a concerted effort to increase this neighborhood approach when it comes to the COVID vaccine, especially as the Biden administration is working to greatly ramp up the output. President Joe Biden signed executive orders to help speed vaccine production and create federally staffed community-based vaccination sites. White House health advisor Dr. Anthony Fauci is confident the president's goal can be met.
The goal that was set by the president of getting 100 million people vaccinated in the first 100 days is quite a reasonable goal.
Along with hitting a number, there are concerns about equitable distribution. Texas shows far more whites getting the initial vaccine doses than communities of color, even with huge gaps in data collection. Is it an equity issue or a supply issue?
Well, it's a little bit of both.
Baylor College of Medicine's Dr. Cedric Dark says he understands the initial vaccines going to large healthcare providers because frontline healthcare workers were the first priority. But as the program expands, there has to be a concerted effort to get the vaccine into more already underserved neighborhoods, areas where internet access for online registration or transportation to hub sites can be significant hurdles.
Maybe we can start rolling this out into the community in churches and barbershops, that sort of thing, where people actually are.
There's simply not enough supply to meet the demand. You know, we are hearing it from all quarters.
The state health department's Chris Van Duzen says hitting all communities evenly is a priority, and newly created hubs around the state are being tasked with making sure the vaccine is accessible to everyone who currently qualifies.
Part of their commitment is that they are identifying ways to get vaccine to these hard-hit populations.
During a stop in Houston, Lieutenant Governor Dan Patrick also says the state has to rely on local officials when it comes to directing neighborhood-based efforts.
We can't control every dose in every neighborhood and every street from the state level, but that's where you get your mayors and your county judges, and they have to be communicating to the public.
State health officials estimate there are about 10 million Texans in the 1A and 1B phases of the vaccine rollout. As it stands now, only about 1.3 million have gotten that first dose, and only about 200,000 have gotten both doses. Reporting live from Northwest Harris County, Robert Arnold, KPRC, Channel 2 News.
And Robert,